members, it is now 8:30, and we will call the Senate Public Health and Welfare Committee to order. Just a little bit of housekeeping for you this morning. I know if you've looked at the calendar, it shows bill introduction, last day for bill introductions into committee is the 11th, I believe. But that is actually the date that they are supposed to be read in on, last day they can be read in on the floor in Senate chamber. So the actual last day for bill introduction for this committee will be tomorrow. So there was a little bit of a confusion. I was expecting next week to be the last week for bill introductions for committee bills, but it is actually, the deadline's the 8th. We're not meeting on the 8th, so tomorrow will be our last day for any bill introductions as committee bills. We are not. No, we do not get the prolonged stuff. Senator Stefan? I just okay. Then the other thing that I have, just for quick housekeeping, we will have to do a better time, and it's all on me, of time management. We are told 50 minutes and not to go past 50 minutes. So if we are looking like we are going 50 minutes, it's not that I don't want to hear your questions or your responses. Is I got called to the office, and so so I've got to do a better job there. So the other thing that we have is bill introductions. So are there any bills to be introduced? And for the first day that I have dedicated to being on time in 50 minutes, our WebEx is not cooperating. Senator Gossage, you have a bill introduction?
I do. It's RS 0953, providing for short-term limited duration health plans.
Okay. Committee, you've heard the request for that bill introduction. Are there any objections? Seeing none, that bill will be introduced as a committee bill. Do we have any more bill introductions? None? Okay. Does anybody have anything of good relevance while we're waiting for WebEx to work, so the people listening online have something to digest or be entertained with? Senator Gossage?
Thank you, Mr. Chair. We had some discussion in our joint meeting, if you guys recall, with the House side on the Health Committee, and we were really concerned about nursing homes, particularly independent living facilities. So I've heard back from Debbie, totally forgot her last name, but she is over all of the Kansas independent facilities, and she said the counties have been working with them, and they don't know that they're going to get somebody to come to the facility yet, but that's what they're working on. But it looks like things are happening with the independent living, and wanted to thank us for stepping in and getting information for them.
That's very good news to hear. Anybody else have anything of value? Senator Stefan.
Yeah, at that same joint meeting, there's a lot of conversation about how the vaccines were going to be distributed out. And in Reno County, the real push was to see the health department receive them and then get them the vaccines out to the clinics and such. The health department chose to keep it. Put down. Okay, thank you. The health department chose to keep it and start one of those big citywide injection locations, and we were incredible, but I'm very pleased to report that they pulled it off really, really well. And one of the keys was they reached out and got a lot of volunteers there. They had a big location where people could come in. They actually had golf carts to pick people up from their cars and get them to the front door. They were very creative, and it reportedly went very smoothly. So I thought that was a ray of sunshine on a kind of cloudy day.
Very good news. And this was Reno County? Yeah. Hey, good deal. Thank you. Do we have an update on WebEx? Senator Petty.
Since we're doing, my county's better than your county. So Wyandotte County has actually been looked at, and so my Johnson County friends in here will appreciate this because half of Johnson County grew up in Wyandotte County. So, so people in Johnson County are saying, well, why is Wyandotte County doing such a better job than we are? And so Wyandotte County has done an exceptional job. And as the senator from Reno referred to in Reno County, they, in Wyandotte County,
welfare system. The demographic of people we target to assist are relative caregivers, non-related kin caregivers, and birth parents. We strive to help the children of Kansas by providing support, education, advocacy, and training to caregivers to help empower them to break negative actions and behaviors, as well as equip and empower them to do whatever they need to do for their families to bring about positive change. This includes parenting classes, advocacy, free food, clothing, as well as mental health and spiritual services. I am before you today in support of Senate Bill 12 that was reintroduced to this committee by Senator Aletha Foscudo for two reasons. First, transparency and trust, and second, our Kansas families. In order to build trust in a relationship, you must first be willing to humble yourself, and that includes being transparent. In the interest of truly providing the services our Kansas families need across our diverse state, in my opinion, a continued effort to strengthen the relationship between our legislators who represents Kansans and the Department of Children and Families who exists to serve Kansas. To effectively bring about the change our Kansas family need, Kansas legislators will need to know and understand what is working and what is not, and then produce legislation that will allow DCF the freedom to do what they need to do in order to make concrete differences in the lives of our Kansas. Under this new DCF administration and with the assistance of Family First Initiative, DCF has been steadily striving to incorporate evidence-based and promising prevention and intervention services. From my standpoint as a community partner who works with the demographic this bill is desiring to represent, I have seen and worked in collaboration with DCF staff across the state who have a sincere desire to ensure the work DCF contracting community departments and stakeholders are providing to and for families are beneficial as well as producing results. As a result of this, DCF has kept more families together and reduced the need for out-of-home placement. DCF current practice model is all about strengthening the family. DCF is striving for Kansas to become a kin-friendly state. This work and belief system includes not only DCF, but contracting community partners and stakeholders. This work seeks to assure the safety and well-being of not only the child, but of the entire family. One important thing to remember is that not all program service models have a rating for evidence-based and or promising, but they may still be effective and beneficial. One such program that DCF has been implementing is Kevin Campbell's Family Finding Program, which helps to find and connect foster children to their family members or other adults who love and care about the child. Identifying healthy connections and loving family members can improve reunification rates, improve placement stability, and help the child have family connection with transitioning out of foster care. Healing from trauma also happens within these relationships. This program challenges child welfare professionals to think outside of the box. It would be important that this bill would also allow DCF the freedom as well as trust DCF to make decisions regarding programs. DCF continually researches and reviews programs that may not be evidence-based or considered promising from a clearinghouse. DCF goal is to provide services that may still be and are beneficial to children and families across Kansas. My mother used to tell me when I was 18 that she could not tell me what to do anymore, but all she could do was advise me. My hope and prayer that this bill will allow this committee to help guide, but not take over. It is also important to have legislators who are knowledgeable of Kansas child welfare. Community partners, stakeholders, and DCF must be willing to be transparent to produce trust on behalf of legislators. But legislators must also be willing to be transparent and produce trust on behalf of the community partners, stakeholders, and DCF. This will allow everyone to move in a forward and upward motion on behalf of our children and families of Kansas. So I want to thank you for the opportunity to share with you today, and may God continue to bless the work you are all doing. This concludes my testimony, and I am now open to any questions you may have. Thank you.
Tina, thank you very much for your testimony. And committee, we're going to hold off on virtual questions for the virtual attendees until after all of them have had a chance to testify. Next up, we have Mike Fonkert. He is with Kansas Appleseed. Mike, welcome to the committee.
Thank you, Mr. Chairman, members of the committee. I hope you can all hear me all right. My name is Mike Fonkert, and I'm the campaign director for the Just campaign with Kansas Appleseed Center for Law and Justice, which is a nonprofit, nonpartisan organization dedicated to the belief that Kansans working together can build a state full of thriving, inclusive, and just communities. Kansas Appleseed supports Senate Bill 12 because we believe that the highest standards and the highest levels of accountability possible should be the goal for our policymakers as we look to continue to improve our child welfare system. I'll be brief here today, but as many of you know, our foster care system continues to be in crisis. Too many Kansas children are in the Kansas foster care system, and there are particularly troubling statistics that I highlight in my testimony that I'd like to draw some attention to that really stick out to me. Less than 17% of children currently attend the same school as they did prior to their entry into the foster care system. As we can see, based on the graduation rates for this past fiscal year of only 16.4%, that's clearly a problem. We also have racial disparities in this system as well, with Black children in Kansas being over 2 times more likely than white children to be in foster care. And finally, I would highlight that more than 11% of children currently leaving the system are re-entering within 12 months. All of these troubling statistics are based on the most recent data available, and this bill is one of many that will be considered this year aimed at improving oversight and improving accountability for these systems. I would just encourage you all to really value the kids in Kansas and to work with us all to create mechanisms that allow us to achieve independent oversight and achieve rigorous accountability for those that we're entrusting to care for our kids. With that, I will close and open myself up for questions, although I will say I do have another commitment, so I'm probably not going to be around to answer any questions. So I would like that for the committee, and thank you for your time.
Thank you for your testimony. Committee, we will open it up for questions. It looks like Nina, it looks like you're the only one left to answer questions. So committee members, do we have any questions for Nina? Senator Petty.
Thank you, Mr. Chairman. And Nina, thank you for being here today. I did, you mentioned in your testimony about how the bill speaks to in number 1, the services that are required to be delivered under any contract in order to assure that providers have the ability to provide adequate, appropriate, and relevant evidence-based services to individual families. And you did speak about a program that you think is being used as effective Campbell's family funding, but that it's not evidence-based. So could you did you work those two together about how the bill speaks to evidence-based, but yet you're talking about a program that is doing a quality work but isn't evidence-based?
Correct. Thank you, Senator Petty and Mr. Chair. One of the things, I've been working in child welfare for over 20 years, and one of the things that I have learned is that although some things may be evidence-based and or promising, may not be as effective. One of the interesting things about Kevin Campbell's family finding that has not been gone through the rigorous motion to become evidence-based and or promising is that it causes all staff, regarding whether it's DCF staff, contractors, stakeholders, to think outside the box when it comes to these children in foster care. Having adopted 6 children from the foster care system myself, all of my children wanted that connection with their birth families. And sometimes in our system, people get comfortable and just do the bare minimum to be able to get this child through the system. But what happens is that these children lose a lot of family connections that are important to them, and to give them the motivation to keep going and to be healthy and have good well-being. One of the things that the family finding does, it has them look at every connection that child has ever had. And it also works to see, because a lot of times there are family members who really don't know what's going on with their relatives. And this has the DCF, this has the contracting state child welfare placement organizations to be able to connect with them and see how you can build those connections for those children. So although that program is not evidence-based, it has been so beneficial to our children. Many children who didn't have any connection with family finally have connection with family, and that is so important to them. And sitting through that training, it made, and how they did it, they had all of us sitting together and they broke us up where we had different people at the table. So there was DCF at the table, juvenile justice at the table, and we had to work together to solve that problem regarding that child. And in those 3 days of meeting, we saw changes happen with these children being connected to family, which is very important to them. So although it's not evidence-based, the evidence is that it works, and it helps children get connected and reconnected to family members, especially those who are aging out, who may not have that connection, to be able to reconnect with family in a positive way.
Any members? Dr. Stefan?
Could you all help me understand where we're looking at the development of a plan? It's not clear to me why that requires legislation. Can't that be done outside of legislation?
In theory, the agencies could adopt on their own evidence-based or performance-based contracting. Sometimes they need a little nudge to say, hey, if you're going to do a contract and you're going to spend taxpayer dollars on this service, the legislature can say, and I think that's what we're attempting to do, that it's not an option for you. We want performance-based contracting, and I believe that's what this bill is attempting to do. Senator O'Shea.
Thank you. I think my question was somewhat similar. I was thinking about the mental health task force this summer that built this plan, brought it to us, which doesn't mean necessarily everything's going to happen, but it was a plan. And I wondered if this could take either route of, right, and like what's the difference between this bill and what they did this summer with mental health and creating that plan?
That I can't answer. I wasn't on the mental health task force, so I apologize. Senator Baumgartner.
Thank you, Mr. Chair, and I think Tanya Keys will address this in her testimony, the neutral testimony, but right now, some of these programs that DCF is utilizing in the community. So we're not talking about the contractors that specifically are placing kids in foster care, but those community-based programs, those are done through grants, not contracts. So this is a movement, rather than them just being grants, that they actually be contracts with the state. Thank you, Mr. Chair.
Thank you. Senator Gossage, and then need to move on to our neutral testimony.
So just for clarification, what I'm reading in the bill is that the difference would be that the department has to come up with a plan to be evidence-based and then be reported to the House and the Senate, be reported to the members. Correct?
That is my understanding as well. Committee members, we will now move to our attention to our neutral testimony. Our only neutral testimony is Tanya Keys. She's the Deputy Secretary for DCF. Tanya, welcome to the committee.
Good morning, Mr. Committee. Thank you for an opportunity to speak about Senate Bill 12. You've heard a little bit about the purpose and the focus of the bill. This is an important bill. DCF is neutral. We have already implemented a number of the provisions in this bill. We currently have performance-based contracts in our prevention grants and contracts for Family First, for family preservation, and we also have performance-based outcomes in our foster care grants. So we already have some of those pieces. We are fortunate and we appreciate the legislature's support for Family First. In October of 2019, those grants that were issued included demonstrated well-supported evidence-based programs, specifically multi-systemic therapy, functional family therapy, Healthy Families America, which is an early childhood home visiting program, and also family-centered treatment. So these evidence-based programs are well supported, which means that we are able, through our plan, to draw down federal match dollars for those evidence-based programs in prevention. Likewise, our family preservation contracts do have two outcomes around safety and stability. They have additional outcomes regarding substance use and children's birth being substance-free. So we do have those, and our foster care grants have approximately 10 to 12 performance-based outcomes that have their base in federal definition and federal operational definition. So we currently have outcomes and performance-based for prevention and foster care. We also have a quality assurance system that says that if they're not meeting administrative conditions of those grants or contracts, they develop corrective action plans for that. If they're not meeting an outcome that is a data measure, they develop a performance improvement plan consistent with the federal requirements for that. And we do have a penalty schedule that would be set in place if over time, when they don't meet the conditions of their corrective action or their performance improvement plan, there is a penalty schedule that is applied over time. We wanted folks to be sure to know that. With regard to stakeholder engagement, we have a number of robust stakeholder groups that meet, and Ms. Shaw-Woody spoke a little bit to that, but just we have one that helps us with prevention in our family preservation work group that meets quarterly. We have a permanency advisory committee that meets 5 or 6 times a year. There's one for adoption policy and adoption incentive work group. And we have a couple of new ones. One that came with the Family First Prevention Services Act. This one's pretty neat because each of our 6 regions has their own local team that is a collection of stakeholders to talk about implementation and accountability and to advise the Family First prevention programs, as well as the progress with qualified residential treatment programs, which was a part of that federal act that started in October of 2019. And then there's a statewide group for that. So members of those local groups in the regions build up and represent a statewide Family First advisory group. That group, we're really fortunate, is facilitated and led by KU School of Social Welfare and the Center for Public Partnership and Research. They help us with that, and they are charged, we are required in our federal preservation or prevention plan, that we have a robust evaluation. So KU in their role is also with the evaluation of the outcomes associated to Family First. So we're fortunate to have that. One piece effect of this legislation that we wanted to touch on a little bit was that it would require a reinvestment of savings from reduced foster care caseloads. Just a reminder to the committee that the legislature and the governor's office have a procedure for some agencies in some budgets. Those are analyzed semi-annually through the consensus caseload estimating group. Currently within that framework of the consensus caseload group or consensus caseload estimates, it does not allow a state agency to retain any unneeded funds for other programs. So that's just a technical piece on the budgeting. There would be no fiscal impact to the agency to implement this. We are already implementing evidence-based programs and performance-based contracts. And thank you for the opportunity to provide information for Senate Bill 12. I'm happy to answer questions when appropriate.
Thank you for your testimony. Committee members, do we have questions for the conferee? Senator Stefan.
Thank you. And this may go back to Ms. Moyer. Again, to clarify my question earlier, it looks to me like this legislates a process. At any point, does it legislate evidence-based contracts or performance-based, or does it just legislate a process to recommend or look at how that would be done?
Jenna, I think that question was directed to you. If you could answer that, please.
Yes, Mr. Chair, sorry, we're getting a little bit of feedback. I don't know if an extra person or two has their microphone on. Oh, that's actually a lot better. Okay, so this would mandate the process that would need to be followed in order for DCF. It essentially mandates the plan to implement these types of contracts, and the plan would mandate that the providers of those services follow performance-based, evidence-based practices in early intervention services. I hope that answers your question. If not, you can let me know.
Do we have any further questions for the conferee? Senator Baumgardner.
Thank you, Mr. Chair, and this isn't so much a question, but it's a statement. I think if you look at the information that is shared by Mr. Fonkert from the Appleseed, if there is a problem with Senate Bill 12, I would say that it just doesn't go far enough. For us ever to have any savings in foster care with regard to reduced caseload, it would require that we have significantly fewer kids in foster care. The fact of the matter is, the time that I've been in the Senate, this is the start of my 7th year, the number of kids in foster care has not moved much at all. And we are considered to have the highest percentage of kids in foster care than most other states. We have a horrific graduation rate of kids that are in foster care. We know that most kids will be back in foster care from the first time that they're in. They're probably going to be in again within the next year. We have kids reported to have been moved as many as 30 times in foster care within our state. And the racial disparities are absolutely alarming. There is no way the representation of minority kids in foster care so outnumbers kids that are non-minority. And so while we do have partnerships and while DCF has offered these grants, we are not moving the dial on kids getting in foster care. We are not moving the dial on kids continuing to cycle in and out of foster care. So I appreciate that Senator Faustido brought this to us. Until we have real clawback, until the organizations that DCF contracts with for foster care, until changes are made, we're going to continue to have most all kids in foster care. I think the data is only about 12 kids that are placed in foster care get to stay in the same school or school district from prior to foster care. So these kids are literally yanked from their schools and moved to different parts in the state. So until I don't think this is getting at the heart, Mr. Chair, of the problems that there is a problem. This is an attempt, quite frankly, to address the question of our fellow senator. DCF could start doing this any day. They have not. They have grants, not contracts. And so a contract, a performance-based contract can be written so that all funding is not received until actual performance is demonstrated through data, and we don't have that in our state. Thank you, Mr. Chair.
Thank you, committee members. Time for one last short question. Senator Petty.
Thank you, Mr. Chairman. I think it's important to also, we go back to Mike's testimony of the importance of, and I wouldn't disagree with most of the things that Senator Baumgardner has said, but that early intervention, and this, I think this just brings home, again, how important it is for us as a legislature to look at what we are investing early, because if we want to keep children out of foster care, and if we want to reduce our numbers in the state, we have to think about what are we doing with families early, and that means 0 to 5, and not waiting until they are in stress and are now part of the state system that we don't want to see that happen, because once they are, then we are faced with where can they go, where do we have the sources for, whether we have the homes for this, and that's why they're not being able to stay often in their same school district.
Thank you, Senator Petty. Committee members, this will close the hearing on Senate Bill 12. I think I am in good standing today as far as time. So with that, no one is waiting at the door to come in. So miracles do happen. So I do want to, just one last item. Next week, I would like to work some of these bills that we have had a hearing on so far. Senate Bill 12, Senate Bill 83, and Senate Bill 85. So if you have amendments that you want for those bills, please get with the reviser so we can get those ready and we can start working some bills and get some bills out onto the Senate floor. And with that, committee, we are adjourned. Thank you very much.